Hello and welcome to Indigenous Healthcare Inequality, produced in Calgary, Alberta, out of Mount Royal University's Criminal Justice Program. I will be presenting this segment to you alongside Jisoo Lee, Hannah Sommerfeld, and Abby Curlock, and we will be your hosts for today's episode. We will be discussing the legacy of colonialism and its relation to the systemic racism faced by Indigenous people in the healthcare system today, and inviting you to spread awareness of this issue, which currently receives limited attention. No matter who you are or how small of a role you take to contribute to change, becoming involved by using your voice in social media platforms is the first step to improving lives. We hope that you enjoy and learn something from our podcast and you feel inspired to spread awareness in your community today. Thanks for tuning in.
Indigenous people face many variations of racism throughout their lifespan. Specifically, systematic racism, which is referred to when society tries to preserve the economic and political dominance of white culture over all remaining groups. Another way of looking at systematic racism is organizational cultures, practices, policies, and procedures that marginalize or create unfair barriers for other groups within society. The concept of systematic racism is specifically shown throughout the healthcare system. Healthcare is incredibly important to the well-being of everyone in society, but discrimination is still shown throughout. The overall issue of systematic racism is not something which has one concrete solution. These problems are a domino effect due to major past injustices. The connection between healthcare's impact on Indigenous people have been mainly focused on stereotypes, biases, and other discriminatory effects. All these unfair treatments are based around the poor funding given to healthcare facilities on reserves in Indigenous communities. Along with that, those who branch out to other facilities off their communities are faced with other racist issues. The change for the systematic racism will need to be major, and the awareness of the issue should not be overlooked. Throughout the podcast, all these issues and concerns from the past to present will be brought up, along with some disturbing stories. The intended audience will be put out to the general public. This information will be spread through a very large media platform called Instagram. Using a platform this big will allow for the content to get out fast and be able to spread outside of just Calgary. Our podcast will be presented to raise awareness of systematic racism within the healthcare system. This includes bringing up the definition of systematic racism, explaining the issues and how they form, along with many other different aspects within the healthcare system. This certain media platform will also allow people to give their input as well as share their stories. Bringing present stories allows individuals to notice that these discriminatory and wrongful actions of racism are not just an olden day issue, but are relevant and demonstrated all the time throughout society now.
It is important to understand the factors which led to the reluctance of Indigenous people to access healthcare facilities and services, which ultimately contributes to the heightened rate of self-medicating through the use of drugs and alcohol in Indigenous communities. The negative experience the Canadian healthcare system provides Indigenous people begins upon initial contact, and the relationship between both parties will be discussed as follows. The negative service experienced by Indigenous people when in contact with the medical field initially begins with an unwelcoming environment where healthcare providers are not equipped to adapt to the needs or the preferences of Indigenous people. The discriminatory treatment on behalf of healthcare workers remains a significant barrier to Indigenous people's healthcare access and well-being. Stereotypical preconceptions held on Indigenous people by the healthcare workers determines the quality of care they receive, as well as the friendliness and degree of support provided by the healthcare staff. Several preconceived ideas and notions exist when treating Indigenous people, which include summarizing their health concerns to issues related to alcohol and drug abuse. This leads many Indigenous people to be misdiagnosed, as their health concerns are brushed off by the assumption of drunkenness. Through this widely accepted perspective, any medical condition an Indigenous person may have is attributed to alcoholism, while any connection to the violence of ongoing oppression is dismissed. The lack of concern for Indigenous patients in hospitals and other healthcare facilities has resulted in detrimental, if not fatal, consequences. Summarizing Indigenous deaths while in care to alcoholism as a way to deflect responsibility of negligence and present these tragedies as if they are unavoidable happens all too often in Canada. The story of Brian Sinclair is deserving of recognition as his death transpired as a result of the lack of consideration healthcare providers afford individuals who are Indigenous. Sinclair died in a Canadian emergency room in 2008, which he was sent to by his physician to receive attention for a blocked catheter. The healthcare providers in the emergency room assumed that Brian was a drunken, poor, and homeless man seeking their shelter rather than service, and therefore he was regarded as a low-priority patient. 36 consecutive hours passed while Brian waited without treatment in the emergency room before healthcare staff finally decided to check in on him when he would then be pronounced dead. Brian's death demonstrates how the Canadian healthcare system is failing the most vulnerable people and draws on the necessity to renew the call for Indigenous healthcare research to place emphasis on discrimination within the healthcare system. Paul Alphonse was another Indigenous man who died while in the hospital and endured extensive abuse. Similarly to numerous other deaths while in healthcare facilities or police custody, Paul was regarded as just a drunken Indian who was far beyond the possibility of fixing, therefore not deserving of attentive care. Indigenous bodies are regarded as helpless, irreversibly damaged, and they are treated as if they are already dead. It is for this reason that public attention must be directed towards these instances, as Indigenous lives continue to be regarded as not worth caring for. How many Indigenous people need to die in order for the healthcare system to be held accountable rather than being viewed as a universal luxury? It is the ignorance of the healthcare system to fail to bring more attention to such shortcomings and publicize the reality of Indigenous people's experiences with medical attention in Canada. However, assigning responsibility to prevent such tragedies from reoccurring solely to the healthcare system is ineffective. In order to generate a greater sense of obligation, the general public's perspective on Indigenous people has to be that they are worth saving as well. It is for this reason that everyone has the responsibility to respond and work towards restoration and push for the equal treatment for Indigenous people, not just in the healthcare sector, but in all facets of an Indigenous person's life. Through creating a greater sense of obligation by assigning responsibility not only to medical professionals or to policy workers, but to the general public, action can be taken and change can be made if improving Indigenous lives becomes an inclusive group effort. Deaths of Indigenous people, which occur while in the care of medical professionals, clearly indicates negligence. However, it is generally concluded that no one can be held accountable for such occurrences, which allows the issue to perpetuate. In order to contribute meaningful research towards this topic, cases like Brian Sinclair and Paul Alphonse have to be regarded as the consequences that racism, stereotyping, and systemic challenges have on the health outcomes of Indigenous people. In addition to the cases mentioned, numerous other Indigenous people have experienced varying degrees of discrimination when accessing healthcare facilities and report that negative treatment provided makes them reluctant to access services in the future, which creates barriers to health equality. While some Indigenous patients prepare more for mistreatments, others avoid accessing healthcare services altogether, which further puts them at a greater risk.
To gain a deeper understanding of how the unequal and inferior treatment of Indigenous people by the Canadian healthcare system fits into the larger and sustained issue of systemic racism, it is important to become aware of the racist policies, laws, and practices of the near past that have set a foundation to the undisturbed accounts of discrimination present today. The worthy of note government policies that have set the precedent for the abuse of power displayed by the Canadian healthcare system are going to be talked by me. So, as a community, we tend to ignore systemic racism that occurs within the healthcare system because of the commonly held stereotypes on Indigenous people. However, it is important to attempt to locate the origin of these stereotypical representations and gain a more holistic perspective into the lives and realities of people of Indigenous heritage. There is a commonly held misconception that most to all Indigenous people use and abuse alcohol and other illicit drugs. This assumption is largely misrepresented, as research has shown that fewer Indigenous people drink as compared to non-Indigenous people in Canada. Yet, when Indigenous people do drink, they tend to drink more heavily than the general population. It is commonly misunderstood that Indigenous people are inherently incapable of handling the consumption of alcohol, and that white people are able to handle it with more responsibility and caution. This perspective eliminates the role that alcohol has a coping mechanism to deal with the generations of pain, violence, cultural displacement, and colonialism. To view alcohol as a problem exclusive to the Indigenous population is to straighten the stereotypical representation of an Indigenous person as a drunken Indian and overlook the fact that alcohol addiction is not racially exclusive. It is additionally important to bring attention to the fact that Indigenous people face unique issues, as Aboriginal peoples have experienced the most entrenched racial discrimination of any group in Canada. Substance misuse within Indigenous communities is misunderstood and leads to the harmful stereotypes and discrimination. It is important to gain a more accurate understanding of why substance abuse issues present themselves to the Indigenous population. A significant contributor to the abuse of substances and self-medicating is due to the intergenerational trauma rooted from the existence of residential schooling. Residential schools were created to, quote, get rid of Indian problems, quoted by Duncan Campbell Scott, who was the deputy superintendent of the Department of Indian Affairs. Heavy drinking, in combination with other risk factors such as violence, poor housing conditions, poverty, unemployment, and the loss of cultural norms, practices results in severe cultural displacement. These disruptions have resulted in an increase of stress, self-destructive behaviors, substance abuse, and suicide to deal with the government-imposed disaster that residential schools have caused. The extreme trauma experienced by the residential school children has strongly affected following generations, as the abuse and suffering has led to a breakdown of culture and a state of normlessness. These factors are strongly related to the heavy use of alcohol and other intoxicants to escape emotional and psychological pain. Yet, the general public fails to realize the damage that has been done, which has led to a substance misuse. The healthcare system, too, accepts the commonly held belief and misconception that Indigenous people access to healthcare services and facilities are because of their own fault. This leads to the idea that Indigenous people are in poor health because they lack the initiative to take care of themselves, rather than considering the historical practices which have led to several systemic challenges such as abuse, poverty, and cultural genocide, which can all be attributed to decreasing health amongst Indigenous communities. So this leads us to talk about the 60s scoop. So what is the 60s scoop? In the late 1950s, all the way through the 1980s, thousands of Indigenous children were taken from their families and communities. The term scoop comes from the scooping of the child from their family. So like literally scooping the child out of their homes. And they were placed in a white foster homes and adoptive homes across Canada, and even sometimes in other countries such as the United States and even as far as New Zealand. Biological families and communities were not told where the children were being placed or going. The children were usually raised with no access to their culture or family. Some of the children did not find permanent homes and were constantly being moved from one home to another. Most of the children were feeling unconnected to any place or anybody. This was a practice of the residential school system that was winding down. The outcome produced generations of adults who grew up never being nurtured by their families, social breakdown, alcohol abuse, and poverty. From my knowledge of skimming articles and the daily news, a couple of the 60 Scoops adults have reconnected with their families and communities. The government decided to compensate the 60 scoop and residential school survivors, but that's not including everybody. But we also need to note that just because they are being compensated does not mean that they are helping them heal from the trauma and help them to fit into society. Due to the physical and mental trauma from residential schools and the 60 scoop, drinking alcohol and abusing substances was one of their ways to be able to cope with the trauma. This is where the stereotype has started, basically, and was created. However, not only do they struggle with the discrimination within the healthcare system, but they also struggle to find transportation to and from the hospitals. These are some basic needs that aren't really met within the Indigenous communities. And also, there are no hospitals built on reserve land. An article I came across titled Access to the Healthcare on Aboriginal by Jisoo Goraya, and she has mentioned that there is about 50% of the Indigenous population that live on reserves, and the life expectancy on reserves and rural communities are 5 to 7 years shorter than most of Canada. There was about $48 million pledged in improving the transportation and having skilled professionals within the Aboriginal communities and healthcare systems. However, the reserves are still underdeveloped and they still face barriers with healthcare, such as transportation and long wait times. And we also rarely think of weather conditions on reservations, but sometimes they are dealing with harsher weather conditions depending on where they are located.
The relevance of both racist and discriminatory government practice and policy to the treatment and service Indigenous people receive when in contact with the healthcare system is that the same type of discriminatory treatment that we saw when Indigenous children would be apprehended from their homes a number of years ago still continues today, as Indigenous people are treated with a substantially lesser degree of care than other ethnic populations in Canada. Just as Indigenous people are overrepresented in jails and prisons in the justice system, they also account for a disproportionate amount of deaths in Canadian emergency rooms and healthcare facilities. Additionally, a substantial portion of the general public does not realize the degree of cultural displacement and assimilation Indigenous people have endured and continue to experience, which contributes to health risks and problems, along with addictions to cope with such cultural breakdown. These ignorant perspectives held on Indigenous people are embedded within the structure and practices of the Canadian healthcare system, which is why we see such negative treatment afforded to Indigenous individuals.
So we talked about a couple reasons of why there might be some stereotypes against Indigenous people and their communities, but we will also talk about the barrier to healthcare system access experienced by the Indigenous people. This leads to an increase of health concerns which pose detrimental, if not fatal, consequences. The significance of this issue is additionally emphasized through the disproportionate burden of disease, which affects Indigenous individuals and communities. Within the Indigenous population, mortality rates are much higher than that of non-Indigenous populations, and life expectancy rates are respectively lower than that of non-Indigenous populations. The outcomes of unequal access to healthcare services will be considered next.
Canada has been praised by many for its universal healthcare system, yet it still fails to meet the healthcare needs of a not insignificant portion of its population, with the most vulnerable being among them. This is a large concern when considering the impact healthcare access has on health status. If one is without access to healthcare, it stands to reason that their personal health is comparatively worse than those with access. Over the years, studies have been done which reveal access to healthcare is not equal for all as may be believed. Marginalized groups such as the poor, substance users, the homeless, and racial minorities have less access to healthcare than the rest of the population. This is especially troubling when considering that some Indigenous people can, at times, encompass all of these groups. Indigenous people experience notable inequality when it comes to health status, morbidity and mortality rates, and access to healthcare compared to non-Indigenous people as a result of the systemic racism Indigenous people face. Lack of healthcare access is an even greater issue for Indigenous people living in urban centers as opposed to living on reserve. Urban Indigenous peoples have higher rates of homelessness, suicide, tuberculosis, HIV and AIDS, diabetes, and substance abuse issues, making it much more likely that these people will experience vulnerability to health problems in their lifetimes. This is a concern as, according to Statistics Canada, more than half of the total Indigenous population is living in urban areas, where this impact can be felt the hardest. Indigenous people living in urban areas often find themselves living in poorer postal codes, such as the downtown east side in Vancouver. These areas can be characterized by their high rates of poverty, homelessness, substance abuse, violence, and immense socioeconomic marginalization. People living in these areas may be more susceptible to health issues and require greater access to health care, which they are not likely to receive. The Canadian healthcare system tends not to address the socioeconomic determinants that have significant influence on individual health. In order to address the health disparities Indigenous people face, access to proper healthcare services is crucial. Emerging literature states that racism and stigmatization are at the forefront of healthcare experiences Indigenous people face. Many people do not understand the social and historical contexts of the current health status of Indigenous people, leading to prevalence of racial stereotypes such as the drunken Indian. These internalized negative assumptions about Indigenous people has permitted systemic racism and discrimination to pervade through society, including healthcare professionals and the healthcare system at large.
In addition to Indigenous people not receiving the same quality of treatment and service as their Caucasian counterparts, which leads to an area of negative consequences on health, it must be recognized that the healthcare system contributes to the assimilation of Indigenous culture through Western standardized practice. In this next section of our discussion, we will draw the fact that healthcare, like other government-operated systems, work to eradicate the existence of Indigenous traditional practices, which further disconnects them from their culture.
It has become evident that the negative service experienced by Indigenous people when in contact with the medical field is due to the fact that the healthcare system is not structured nor equipped to adapt to the needs or the preferences of Indigenous people. When an established system was never intended to include a specific group of people, discrimination and racism becomes the consequences. Among the substandard treatment that Indigenous people are granted when accessing healthcare facilities, the way in which Canadian healthcare laws, policies, and practices are structured are not culturally safe for Indigenous people, which attributes to the larger issue of assimilation, where Indigenous cultural practices are driven to blend into the mainstream Western ways of living. The healthcare system operates on a predetermined standard set of practices rather than on a case-by-case basis where each patient or individual seeking medical attention is approached and treated in a manner in which they will feel safe. This leads to differences in terms of aid, medicine, rehabilitation, and recovery of Indigenous and diverse groups to not be implemented nor considered. This dominating system results in the reluctance to address or acknowledge the distinct needs of Indigenous people. Although traditional Indigenous practices are recognized as medically legitimate and are known to have improved the health of Indigenous patients, they are rarely used nor emphasized as significant, which leads many Indigenous people to engage in passive and avoidant coping techniques to deal with their declining health as they are dissuaded from seeking help from the mainstream healthcare system. The Canadian healthcare system is reluctant to provide funding to build new Aboriginal healing centres or improve those needing restorations, hire Indigenous healthcare staff and professionals, allow for the collaboration with Indigenous healers or elders, or incorporate traditional healing practices. Canadian healthcare has effectively marginalized Indigenous people from the dominant system of care, producing little effort to restore the damage done, which contributes to the systemic racism experienced by Indigenous people in all facets of life. Systemic racism, which refers to the ongoing unfair and unavoidable disparities in power, resources, capacities, or opportunities, centered on ethnic, racial, religious, or cultural differences, is present, accepted, and entrenched into the modern Canadian healthcare system, which continues to discriminate against Indigenous people.
The legacy of colonialism and current systemic racism can still be felt by Indigenous people in many ways, including through their poor access to healthcare and the overrepresentation Indigenous people face in the Canadian criminal justice system. This legacy has both immediate and delayed negative impacts on health status, and contributes to the health inequalities Indigenous people face. These significant inequalities indicate the ways in which the legacy of colonialism has preserved the deprivation of Indigenous people as citizens of Canada who are not worthy of equal human rights. Over the decades, there have been many reports showing that the overrepresentation of Indigenous people in Canadian prisons is a result of the systemic racism and the effects of colonialism. Incarceration has a great deal of impact on health status, both directly and indirectly. As well, incarceration has negative effects on socioeconomic determinants of health, including finding employment, having stable relationships, and being able to find affordable housing. When people are not in a position to have these determinants, it increases their risk of becoming involved with the criminal justice system, thus creating a cycle in which prison leads to poor socioeconomic status, which leads to prison. This cycle is exacerbated for Indigenous people due to the historic and current-day colonialism, systemic racism, and social inequality they experience. Incarceration has further impacts on health status for Indigenous people. Being incarcerated increases risks of major depression, acute and chronic infections, heart disease, hypertension, and obesity. On average, Indigenous men lose 4 to 6 times more years of life as a result of federal incarceration than non-Indigenous men. And for Indigenous women, this number grows to 6 to 9 times more years. This could be accounted for through the lower standards of healthcare Indigenous people receive, as well as by the overrepresentation they face. The overrepresentation of Indigenous people in the criminal justice system is largely driven by systemic racism and the aftereffects of colonialism, and it is a substantial barrier to Indigenous people receiving proper healthcare. In order to address the systemic racism in the justice system, the Canadian healthcare system should come together and work with the Department of Justice to clarify and improve their understandings of how systemic racism functions and affects overrepresentation rates of Indigenous people, as well as how it affects Indigenous people's experiences with the healthcare system and their access to it.
So thank you so much for joining us today for our discussion on the topic of Indigenous healthcare in Canada. To become more involved and take action, you can start by sharing our ad on your Instagram story or other social media platforms, along with including the hashtag Indigenous Healthcare. If you have any other questions related to the topics covered today, you can reach us by leaving a comment below or by emailing us at indigenoushealthcare@gmail.com. For your reference, a list of sources we use to make this podcast will be linked as a PDF document, which can be found in the description box below.